Yeah, so we did a study looking to see what hospitals are doing across the country to prevent Clostridium difficile infection, as well as other types of hospital-acquired infections. We focused on C. diff, as it's known, because it's a common and increasingly morbid and life-threatening infection. In fact, the incidence in the elderly has increased tenfold over the last 15 years. So we asked a series of questions about what are hospitals doing to prevent infection, and what we found is that most hospitals are doing the things that they should be doing. They are cohorting patients who have C. diff. They're using dedicated stethoscopes and other types of medical devices. They're washing their hands with soap and water rather than alcohol-based hand rub. But the one thing that we found is that even though they believe the evidence behind antimicrobial stewardship is high, only about half of hospitals actually have an antimicrobial stewardship program. There's a gap between what hospitals think they should be doing and what they actually are doing. And that major gap is somehow figuring out how to restrict the use of antimicrobials so only those patients who actually need the antibiotic will get the antibiotic. I think the key will be to have policy in place so that patients who have, for example, asymptomatic bacteriuria, they have bacteria in their urine, but they have no symptoms of a urinary tract infection. The vast majority of those patients should not receive an antimicrobial. Unfortunately, a lot of those patients do get treated inappropriately, which not only leads to potentially C. diff infection and increased healthcare costs, but can also increase antimicrobial resistance. So I think having a policy in place will be very important, but coupling it with people who are doing most of the prescribing of antibiotics in the hospital. And among medical patients, that tends to be hospitalists. So I think trying to understand how to change the behavior of hospitalists around antimicrobial prescribing will be important.